Hey everybody, Bottom Line Thursday. Got
I love
Brad
it.
and Chris back. Good to see you guys.
Thank you. Good to
Hey,
see
good
you.
morning. Thanks for having me.
So Brad, we wanted to get your thoughts on a couple of things Chris and I have talked about over the last few weeks. We did a two-part series on a large employer survey where it was really talking about the Business Group on Health survey of what's important for large employer health plans in 2024. Chris, you and I talked 2 different weeks, the first four and then the last five, in terms of what we're seeing, and just a little bit of conversation that even some of our clients that aren't considered to be the large jumbo employers are
Sure.
needing to be aware of this. And those employers that haven't thought through this yet, again, we wanted to give some food for thought. But Chris, I know you had a question for Brad specifically with his background working in our market together.
Yeah.
In the many years that we have, what he's been seeing. But yeah, go ahead and ask that if you would. I'm curious what Brad's thoughts are.
So Brad, what caught our eye was that we're seeing the either in-house or near-site clinics kind of hitting a plateau. We've got some clients. We've got one in particular that's actually starting one this year, but it's we have a hard time figuring out could they ever save money by doing so. And you have experience in this. You had, I believe, two clients that were sharing one, and why don't you give us some of your thoughts of, what went right, what went wrong? Are they still doing it? Is it tabled for now?
Yeah, and I saw that same study on the Business Group on Health. Great. I agree with all the different trends that they're seeing, but that plateauing of the in-house clinics, I agree with. And I think in our market, so most of my clients are local or near local to the Quad Cities, at least the headquarters. They can have employees coast to coast, but the decision makers and leadership team is all here. And generally speaking, concentrations of employees in this area that those places might be a couple hundred employees. So a nice size workforce, typically self-funded. They see, hey, my costs are going out the door. If I'm, sending them to the local hospitals or clinics or whatnot, why don't we try to capture some of that at cost, if you will, hire our own nurse practitioner, dedicate some office space for it. Sounds great. Sure does in theory. What we found of the two that I have that have done it, one no longer does.
Okay.
This employer has 500 employees, about 1,200 members roughly. They just found it didn't pencil out. They had a hard time staffing it.
Okay.
And so, as we heard about the provider shortage, and we've talked about nurse practitioners trying to fill that gap, they couldn't even find those folks to do it. And they also found with the advent of telehealth, that took care of not all. I mean, they couldn't do their labs, obviously, but they found that, hey, we don't have to worry about dedicated space to keep up with all the medical rules, to pay the person what we need to pay them to make it worth showing up. And it's often they found that they could just get one person to staff it. And so imagine if you were the single practitioner for the entire workforce, you're going to need a day off. So it's not like you could be there 24/7. And so they'd have office hours. Some of those things don't happen during the day. They had different locations throughout the city. So people that were nearby found it helpful, but those that had to drive 20 miles or whatever just said, I'm just going to go to my local doctor. And so
it's interesting you mentioned that too, because it seems like, again, that those employers were doing the work themselves, or at least being the architect and manager of it. I would agree that that's difficult. Chris, you and I had talked about this. We've seen some third-party organizations that will set up a shared clinic. There's a few in the Quad Cities, mainly, staffing union plans, where they just need the commitment from the employer. But even still, getting that many committed to it can be a challenge. The third one that we saw that I think is intriguing is back to your point of telehealth. It was an organization that will staff basically an PRN or somebody that is just there as a clinician with everything wired up virtually to the doctor at some other location. And they just need the space and have all of the technology enabled, because it is impossible to have that scheduled and staffed if you're responsible for the whole thing. But I think to your point, that management of it in-house is difficult to deal with from a dollars and cents standpoint.
Yeah, I think though the example where it seems to be working at least better, and this other group continues to do it, they found a way to make it more than just a healthcare clinic. It's, all their physicals get done there. So given the nature of the work that they do, they have to have required
Yeah.
physicals. They do those. May have to have mandatory testing on certain things. So they incorporate work comp stuff if they can,
Yep.
and checkups. So they are, anytime a person needs any type of healthcare help or official check, they're
Yeah.
using that. And that seems to pencil out more. But simply saying, hey, let's do a healthcare clinic in case we get cold or flu, or, get your vaccines. I just, unless you're,
Yeah.
maybe if you're John Deere, it might pencil out.
Yeah.
But a lot of your, a couple 100-person employers, it just doesn't pencil out that I've seen.
That's interesting you mentioned that, because the client that we're talking about that's thinking about it is trying to find that local provider that will give the array of services, both pre-employment, work comp, occupational health, and primary care, potentially prescriptions, all kinds of things, and just say if the employees go here, there's no cost to the employee or to their family, and we're going to negotiate something that's going to be affordable for the health plan. But the provider takes all of the medical risk and the employer takes all the financial liability. So I mean, I think exactly what you said might be the direction that we're seeing more employers look. Just that direct relationship with the provider or the clinic itself.
Yeah, and there's a pretty heavy fixed cost burden. You're going to have that cost whether 10 people show
Yeah.
up or 100 show up, that
Yep.
week. And so you just have to make sure you get the volume.
Yeah,
Yeah,
I'm
that's interesting.
one of our local larger clients in the Quad Cities currently has one, Brad, for the work comp side, and now they're expanding it into healthcare. And it's funny, that client has, I think, 6 different unions that they answer to, and I think it took us 4 years of talking about this to finally get those local union presidents to say, okay, because the first time I mentioned it, it's like, I'm not having my employer's doctor.
Yeah,
It's
that's
like,
a reality. That's a
okay,
reality.
so we're
Yeah.
going there. Yeah.
Yeah.
But,
Yeah.
for them, it's like, hey, I want to keep my life separate from work and personal. And as soon as I have one doc that's doing my work stuff and my personal stuff, I don't have
Becomes a
that
barrier
separate.
there. Yeah.
And
Yeah.
that, once they explained that to me, I was like, okay, now I understand some of your concerns. But so I think, Brad, and again, we're still kind of deep into this, is how do you kind of migrate that occupational health along with healthcare, but yet keep healthcare pretty simple. Nothing
Yeah.
that's going to get too, if you have a chronic disease, keep that out of here, right? But if it's vaccinations, flu shots,
Yeah.
I need a lab drawn. Why not get your, go ahead and have that person stick you versus going to a health system that's going to charge you $200 to stick you with a needle when you can do it all part of that fixed cost. So yeah, I believe me, we're probably gonna want your ear and your mouth to help us understand some things that we haven't thought about, because obviously you are seeing it, and you're seeing it where it succeeded and also where it failed.
And you bring up the point with the kind of the union leaders, pushing back. I get it too, even just from a consumer standpoint. You want, we talk about a medical home. You should have one doctor that sees your full thing. And if, the acute stuff can go to the clinics and you're probably just fine. But
Yeah.
really to manage a serious condition, you probably don't want to do that at the clinic. Even if it's just grabbing labs, or at least make sure, how do those touch points communicate?
It's
And that,
hard.
Yeah.
it's like
Coordination
the
is
whole
is another
disconnect. Yeah.
challenge. Yeah. Absolutely.
Well,
Well, good topic. I
yes,
appreciate you sharing.
yeah,
All
thanks for
right.
sharing your viewpoint. I think the whole survey was great, but that was the one that I'm like, Brad could really add something that, Chris and I didn't have time to really dig in deeper. But once again, you have the expertise. So thanks for sharing your view.
Thanks for having me.
Enjoy.
See you next
Thanks,
time.
guys.
All right.
Okay.
Thank you.
See ya.
Yeah. Bye-bye.